Okay, hi doctor.
Hi.
I have a few questions for you today, and I was wondering if you can help me with that.
Okay.
Okay, the first question is, what is preterm labor?
Preterm labor is a condition when a pregnant mother, delivers before 37 weeks of pregnancy.
Okay.
Early preterm labor is before 28 weeks, and then late preterm labor is at between 37 weeks, between 34 weeks and 37 weeks.
Okay. What women or who is at risk for preterm labor?
Um, Anybody that has had a previous delivery before 37 weeks is at risk. Multiple gestation, when the mom carries more than one baby. It could be twins, triplets, or quadruplets. And patients that have shorter cervix on ultrasound when they get done early in pregnancy,
Okay.
or second trimester ultrasound, they are all at higher risk.
Okay. Is there any prevention or treatment for preterm labor?
Once we know the mom is at risk for preterm labor, then if the patient has had previous deliveries that are early, we can start them on progesterone as early as 16 weeks.
Okay.
If the patient has had multiple preterm deliveries, we start them. That delays the onset of delivery. It doesn't completely always prevent it, but we can take it further than what they have been in the previous pregnancies. So there is something called 17-hydroxyprogesterone caproate, or its the brand name is Makina. We can start at 16 weeks, and they get this shot every week until at least 34 weeks. And then if they don't have any risk factor, if they're not on progesterone, if they start having contraction and the cervix is not open, we can give them something to relax the uterus, which is called nifedipine. And if they have regular uterine contractions, then they get hospitalized, and we give them magnesium and steroids for other benefits for the baby.
Okay. And what is the outcome for the baby if they were to be born really early?
If the babies are born, depending on when they are born, if the babies are born after 34 weeks, most of them do well. They stay in NICU for a few days to a couple of weeks. If they're born before 34 weeks, they stay in NICU with they could have multiple problems. They could have, the lungs are not very well developed, so they sometimes stay intubated for a few weeks. Their brain is not developed, so they could have some bleeding in the brain, and eyes, they may have vision problems later in life. So there are a lot of, and then if they're born very, very early, there is something called necrotizing enterocolitis that could happen to the baby. So it's very important to prolong the pregnancies as far as possible with medication so they don't have preterm delivery.
Okay. Well, thank you so much.
That's it.
Okay.
Thank you.
Thank you.